Thank you for joining me today, Dr. Bladen. Firstly, could you tell me what your particular specialism is within ophthalmology?
So I'm a consultant who specialises in oculoplastics, lacrimal and orbital surgery, but also have a particular interest in cancer genomics.
Okay, that's interesting. And during the COVID-19 pandemic, how have you had to adapt your workflow?
Well, initially, all of our clinics and operating theatres were closed, and ophthalmology was on standby to be redeployed to the COVID wards at King's. There was some confusion initially because all cases were cancelled, and even the emergency ophthalmology cases weren't getting through, but those patients were supposed to still come. Some of the ophthalmologists at King's were also redeployed to ITU, where we were patient liaison officers. For me, I managed to help in terms of the COVID research studies that were going on. And for example, we were particularly helpful in the research study that showed that dexamethasone, so a form of steroid, was useful in reducing death in people with severe COVID-19 by up to a third. So we were proud of being part of that as well. Also, we as consultants became first on call. So we were running the A&E, and we were staying overnight. So it was interesting being first on call again and being on the ward. So that was interesting. So it was a huge, huge change for us. But we just wanted to do our part for obviously the pandemic.
Mm-hmm. That's really interesting, especially the part about being part of the dexamethasone research group. I mean, that was such big news.
Yes, no, sure.
And which cases did you deal with during lockdown, and which did you decide could wait?
So King's is a trauma centre, so obviously trauma was still coming through. So we continued to see eyelid, globe and orbital trauma. We actually thought initially we're going to see a massive reduction in cases because people were staying at home. But actually we just saw different types of trauma. So trauma that was happening at home, for example, DIY type trauma, unfortunately. So I continued to see sight-threatening orbital cases, so dysthyroid optic neuropathy needing orbital decompression, for example, or infections of the orbit that needed drainage. And we also saw some orbital and eyelid cancers, but some cancers we were able to defer. The things that we didn't see and didn't have to see were the watery eyes, the droopy eyelids, small benign lesions, and some lids that were malpositioned that don't cause any problem with the eye.
I see. And how do you plan to manage the backlog of patients?
Well, I've been using a virtual platform, so Attend Anywhere, to see some of my oculoplastic patients through the pandemic, and we're still using it now. And we found this to be quite useful for a particular subgroup of patients, and that's the post-operative patient, specifically the ones where you can visually see on the video if there's been an improvement or not. So, for example, if you've got a patient who's got an inturned eye that's obviously causing scratchy eyelashes on the eyeball, and you turn it out, you can see on the video screen that that's much better after the surgery, or hope it's much better, and the patient's symptoms are gone. So those kind of patients you can see with a video consultation, and it saves them having a face-to-face. So we've been using that a lot more. We've found another area where it's useful in is a kind of a triage first service. So we see the new patients via Attend Anywhere to kind of stratify them in terms of risk, but also we can perhaps organise investigations, so like a scan of their orbit, for example, before they come to the clinic, which then makes their face-to-face time much reduced. So it's all about reducing time in hospital. So we've been adapting using virtual essentially to help us.
Mm-hmm. That's very interesting. And finally, my last question is, will cancer be the next big crisis given the delays in cancer diagnoses in the UK after the past few months?
So it's a very good question, and unfortunately we can see already there is a crisis in cancer. For us in terms of eyelid, a lot of them are basal cell carcinoma, which are quite indolent, fortunately, compared to something like breast cancer. And our society, the British Oculoplastic Surgical Society, advises that we can delay seeing these patients for up to 3 months during the pandemic, with hopefully no harm to them. However, I'm also running an eyelid melanoma study that looks at cases of eyelid melanoma across the UK. And prior to the lockdown, we were getting 1 to 2 cases reported a month. And then during lockdown, up until the end of August, we had no cases reported. So that's quite worrying that perhaps, obviously, those cases should still be occurring, but may not be seeking advice. So that's a little bit concerning.
Yes, I see. It does seem like it's quite a concern, and we don't really know how it's going to pan out right now, do we? So we just have to wait, and it will probably be a delayed effect, won't it?
Correct.
Okay, well, thank you very much, Dr. Bladen. It was really interesting speaking with you.
Oh, you're very welcome. Thank you for the interview.
Thank you very much. Bye.
Bye.